We are here at the Convention Center today to get a look at the Department of Health's expanded contact tracing operations. We have seen the triple-digit increases in cases for more than 2 weeks. And today we have an additional 261 new positive cases reported by the Department of Health. When we started seeing this surge in cases, it was clear that we needed to ramp up our contact tracing, and I directed the Department of Health to do so. The Department of Health has already trained and identified hundreds of available contact tracers with the support of the University of Hawaii and the John A. Burns School of Medicine. One of the significant hurdles to address was the lack of physical space at the Department of Health offices. I know that some of you have seen the limited space, and we needed to find additional space to house the contact tracers. The convention center was made available, and the department has been working over the last week or so to set up this facility that you see in this room. And you might have seen the ballroom next door, which is actually filled with contact tracers, making contacts and following up on the positive cases. After touring the operation, I'm confident that the department has the support that it needs to manage the current demand for contact tracing and to continue to accelerate and add more investigators and contact tracing staff. I want to thank Director Hara for providing staff and support from the Hawaii National Guard. These are our citizen soldiers, and they do have careers outside of their service as National Guards persons, and many of them are doctors and nurses and other health professionals that truly help in incidents such as this one. I also want to recognize Dr. Roberson for her efforts in getting this operation up and running in a very short time. As many of you know, she joined the Department of Health staff just a couple of weeks ago, and certainly we've insisted that she hit the ground running. Expanding our contact tracing capacity is critical in the fight against COVID-19, and it is only one of several measures that we must take to control the virus. Yesterday, Mayor Caldwell and I announced additional restrictions here within the County of Oahu, County of Honolulu, and I did sign the Act Now Honolulu No Social Gatherings Order today. It takes effect tonight at midnight, and I want to strongly urge everyone to obey the mandates and do everything possible to help in the fight against this virus.
I'd like to start by thanking Dr. Robertson and her leadership, and allowing us to help her organize and get better at disease investigation operations. A couple of things I wanted to highlight is that, one of our skill sets and one of our, best advantages that the governor mentioned is that we are citizen soldiers. There are a lot of skills and other experiences that the soldiers and airmen bring. So I'd really like to thank everyone that's supporting this operation from the Hawaii National Guard. We are moving forward and looking at expanding even further. So I look forward for further collaboration with the Department of Health. One reason that we're very successful in helping them when the request did come is early on back in March, I told all of the emergency managers and the Hawaii National Guard leaders that we need to be responsive. That is our center of gravity. To be responsive, we need to anticipate needs. And they did that. The leadership, primarily in this case, Colonel Mark Young and Task Force Medical, they're able to anticipate the needs that this request would someday come, and we're able to train our soldiers and airmen ahead of time. So when the request came, we're able to support them within 24 hours. So thank you again, and we look forward to increasing the capacity of the disease investigation operations. Thank you.
Thank you, General Hara. Our next speaker is Dr. Bruce Anderson, Director, Hawaii State Department of Health.
Good afternoon, everyone. I have some, I think, reasonably good news, and that is that we continue to see what appears to be a leveling or a plateauing of the high number of test results seen today. As the governor mentioned, we had a total of 261 new cases But of those 261, 56 were cases associated with the outbreak at OCCC, our correctional center here on Oahu. And 37 were also included in this today's count that were not reported yesterday because of laboratory testing issues on the mainland. The virus is surging in many of the mainland states as we speak, and they are having some backlogs in the reporting of tests. So if you subtract out those 93 cases, we still have a significant number of cases occurring, but we're seeing fewer than we projected certainly a week ago. And along that line, I have to also add that the census in our hospital seems to be stable, and as far as I know, there's no crisis in any of the hospitals. They've been able to manage the cases very well because of the increase in the numbers, or at least the stabling of the numbers. But again, having said that, we have a number of new cases that are concerning, of course. 7 cases on the Big Island, 20 cases on Maui, and the remaining cases, 234 cases, are all here in Honolulu. Many of these cases are still coming from the spread of disease within the communities. These are people gathering in small groups or large groups. And I remain cautiously optimistic that the trend in increasing cases will reverse as we tighten our restrictions on gathering. Mayor Caldwell and the city have taken strong and decisive actions in reducing the social gatherings now to less than 5, and also emphasized the importance of wearing your mask. They also have enhanced enforcement, and these measures are expected to help to bring the case numbers down in the next several weeks. We normally wouldn't expect to see a decrease right away. In fact, we probably won't see the entire impact of even what was done a week ago for another week. It takes 10 to 14 days to get through the incubation period, and hopefully we'll see continue to see a leveling and even maybe a dropping in cases. But it's too early to tell whether these controls have been effective. But the numbers are looking good now, at least. Our contact tracing efforts have continued throughout the pandemic. They started immediately, and our disease investigation staff have been tracing cases since February. I think that's in part, at least, why we've done so well early in the course of this outbreak, is that we were able to follow up on most of those cases very quickly. In fact, our cases were notified within 24 hours and contacted, and we identified close contacts within 48 hours, and that's still our goal. And we're working toward assuring that happens each and every time we hear about a case. We now have a total of 96 individuals working on contact tracing and investigations here on Oahu. 13 additional staff are providing supervision and other services. And we have another 30 staff working on Maui, Kauai, and the Big Island, all actively involved in contact tracing there. And I think they're doing a terrific job. Last month, we began working on identifying a location to house additional workers. We have a number of staff in our main building at Kinohali, but the Federal Credit Union is also being utilized. We have staff working at home and in other jobs. We have public health nurses and others working as contact tracers. And this situation here is a wonderful opportunity for us to expand the capacity to be able to hire more people to build our contact tracing teams. It's a huge milestone to be able to set up in the center because of the limitations and working in a confined space. As you'll see in a few minutes in the adjacent ballroom, one of the first things we did was to rapidly expand the number of contact tracers. There are currently about 50 new contact tracers in the adjacent ballroom. The ballroom is equipped with phones and computer monitors, and the teams are here all day to follow up with those close contacts. Many of them were volunteers previously who had helped us with contact tracing. Others were recruited through the RCUH hiring program we have in place. And of course, as Director Hara has mentioned, we have at least 20 or more National Guards men and women who are providing services at this time. And we're really grateful for their support. All of these people together I think will help to expand our program substantially. But even so, we are going to be ramping up the numbers further. We will be replicating the same setup, or the setup you see here, not only next door where we have a currently staff working, but the opportunity to expand into other rooms here. Each of these rooms can house at least 50 people while maintaining social distancing. And so we hope to very soon have another 100 contact tracers that will help with the investigation. And as we need to, we can scale up from there.